Species edition, and we are glad to be home indeed. Kwame Waja, we are still waiting for you. So wherever you are, make steps to be here with us. And it's a privilege actually to ambush Kafui and Valerie and Thelma. You guys are doing a great job. We appreciate you for keeping our home exciting to behold. So for those of you watching, if you just join us, well, you missed the news, but the show still continues, and we are going to be giving you the health segment immediately. As part of knowing what happens in your thyroid gland, we have known goiter and a few other things, but this morning we'll be discussing what the hyperthyroidism is all about. In the studio, we will be talking to Dr. Osman Ibrahim, the CEO of Nature Blend Clinic. He is here with us. Good morning. Good to have you. Yes. And good morning. Thanks for joining us, and we hope that your morning has been exciting so far.
Thanks for having me.
Okay. So hyperthyroidism, what does it really represent?
Okay.
Is it only in the neck area?
Sure. Thank you. And then good morning to our cherished viewers. When we say hyperthyroidism, the thyroid is a butterfly-shaped gland that sits just beneath the Adam's apple, at the neck. But before it will be hyper, then it means the gland will have to secrete or produce more hormones, because the gland produces hormones, and the hormones that produces by this gland, we could say it's the command center of the human system, because the gland produces the main two hormones that it produces. We have the tyrosine hormone, which is the T3. The T4, and then we have the thyroxine, which is the T3. And these two hormones are very important for the human system. They affect all the human cells. So if this gland produces more of these hormones or releases more of these hormones into the bloodstream, that's when it becomes hyperthyroidism. Then it comes with a series of health complications or health problems. Because why? Because when these hormones are overproduced in the system, it goes to the metabolism. And then once it is hyper, it means there's going to be high metabolism in the human system, because these hormones affect all the metabolism in the human system. Okay. So when it goes hyper, it brings a lot of health problems because of how the symptoms or how it even attacks the human system, and then it has similar symptoms with other conditions. It is sometimes very hard to diagnose. So with the first, it goes there, it has a tremor. You could see tremor in the hands, and then the fingers. The person will be trembling a little. Then a fast heartbeat, or we could say a heart palpitation. It will be there. So with that, it affects the human system and can also even lead to high blood pressure, which is hypertension.
So it doesn't only affect the neck area then?
Yeah.
And any part of the body?
Any part, because these two hormones affect all the cells in the human system. So these same hormones instruct or even control the human system. It instructs the cells how to make use of carbohydrate and then fats, and then also go there to control how the body will produce proteins, and then control the temperature of the human system. So it's a thermostat in the human system.
What causes the hyperthyroidism, and especially the symptoms or the manifestations that you've mentioned?
Yeah, what happened here is we have a condition called Graves' disease, and the Graves' disease is an autoimmune condition. The Graves' disease, the other condition, when it's set in the human system, it makes the immune system to attack the thyroid glands. So with that, it will cause overproduction of the hormones.
Oh.
Yeah, so it's with our autoimmune condition, we know how it comes. It's an inflammatory aspect. So when it comes that way, it causes the gland to produce too much hormones. Of everything. Then it will attack. So with the Graves' disease, sometimes you can see even the bulging of the eyes, and then you have the pounding of the heart, which is palpitation of the heart. So the person cannot breathe properly. Yeah. Then over there we have the overreactive. The overreactive is where we have goiters. You see the goiters and the plumber diseases. Yeah. What does the noodles setting in? Then you to be that over there you see the enlarge of the gland. So you can see over here you can see the normal gland of the thyroid. But when it is inflamed, or when the hormones are overproduced in the system, they get enlarged. So that is where you can see the noodles. You can see the goiter and the plumber disease. Then we have other aspects of thyroiditis. The thyroiditis is an inflammation of the gland.
That also affects the neck region, it can affect other parts.
It affects the neck region. Because the thyroiditis is also believed that it's an autoimmune condition and other conditions that can lead to the inflammation of the thyroid gland.
How bad can it be? I mean, goiter is obviously visible when it affects a person.
Yeah.
But what other effects can it have on the people that can be visible?
It is very bad because when it's setting, you see the person will be losing weight without trying. That's you've not seen even the noodles. The goiter is not there, so it's not physically seen. But this one with let's say the T3 or even with the first aspect, when the hormones are overproduced, you've not seen any noodles. So there's nothing physically prompting the practitioner to see this is what is going on.
Yes.
But inwardly, you see the person will be losing weight without trying. And there's also fast heart rate or heartbeat. And then there's pounding of the heart, that's palpitation.
Yes.
Because you see, because all this condition, it comes with the cardiac system, so it is very difficult to sometimes to diagnose. So it has to take a trend, but it is very common in us these days. It is really having a lot of bad, let's say, negative effect on the human system. This is due to even the kind of stress people we subject ourselves to, and the kind of food we eat also comes in with all this conditions.
Let's detail it a little bit specifically. You've mentioned food and the stress levels of humans. What other activities do we do that prompts these reactions?
Yeah, because the other activities, taking alcohol can also be a contributing factor. You know, taking alcohol, it induces a lot in the human system. And then all these, our highly refined foods, also induce inflammation in the system. Sugar is also part of it. Yeah, but because this is mainly under the immunity, it is whatever you do that will bring the functions of the immune system down. You know, consuming sugar reduces the functions of the immunity. Yeah, that can make the immune system down. So any infection can easily set into the human system.
Are there people who are prone to these kind of, or easily affected by this hyperthyroidism?
Yeah, we would say now it affects all ages.
Once you indulge in these activities.
Sure, in these activities, it affects all ages, yeah.
But they are not like maybe in a bloodline, someone that it's a genetic reason for having it, or not just because you ate something or either, but naturally it will happen because of the family you come from. Is there any traits like that?
Yes, it is, because we have a family line. That's a family history of grave disease or even overactive thyroid or thyroiditis. It's possible. But if it's in the family line, it is possible. Without the family history of those conditions.
The other growth that happens on people's skins, I'm not sure what name you will give it. Does it also have any relationship with this thyroidism, especially when it comes to the goiter? Can it grow on any other part of the body apart from the neck area?
No, please. The goiter only is at the neck area. That's the base of the neck. Yeah.
Especially because you say it spreads to all the cells and it can affect the entire body. How does it manifest then in those areas?
That is when you see a person, for example, you see the person losing weight without trying, a person having fast heart rate.
Palpitation.
Yeah, palpitation is the pounding of the heart is also in there, and the person could also even have tremors. Then you see the hands and the fingers can be trembling. A little small trembling over the tiredness is also there. With a little effort, the person is tired. Or with a little activity, the person is tired. It is also in there. So, and when that also happens, what even makes it much intense on the human system is when the thyroid, the hormones are overproduced in the system, they fight against the potassium in the human system. So over there, you know, at that time, there's going to be a lot of confusion. The person can be, there will be nausea, the person can vomit as well. Yeah, and the person will be generally weak. So generally fatigue will set in. So the symptoms are, because it's very similar to other conditions, that's why I said it makes it a little difficult to diagnose. Yeah. But it is very common with us these days.
Does that mean that usually it's only when it gets to the chronic stage that you would realize that this is exactly what is happening, or as a doctor you were able to detect when people visit you in the early stage?
Yes, because what happens here is with when these hormones are overproduced in the system, they also temper with the sleep aspect. So whenever a patient reports with not being able to sleep, you should, as a practitioner, you should go there, not only checking the hemoglobin and then checking the ferritins, which is the ions, but your mind, you should also dig deep there. Because when one of those hormones are deficient, we are talking of hyper now, but what is happening much, the cases we are receiving much here, mainly is normally deficient hormones. And the deficient hormones also has its own effect.
And are these cases becoming rampant recently?
Very.
Oh,
very. You sit in the consulting room. If let's say 10 people visit you in for the day, you have 9 people having their thyroid hormones being deficient or hyper.
Is there a certain pattern you have identified apart from the alcohol and the eating patterns and the stress? Is there a certain pattern that it's key in all these people that you have identified as having it?
Yeah. What happens here is the old age is also part of it. So when you are aging, it's possible. These hormones can be deficient, or they can be hyperactive. They can be overproduced in the system. Yeah. But apart from that, is mainly our the life activities. As I mentioned, the grave disease and then overactive. All these things, what you ingest in the system, can come with it.
Okay. Yeah. So on the diagram on the screen.
Sure.
If you could explain to us specifically the process that we've been talking about so far and how the effects.
Yeah.
Okay.
So you could see just beneath the larynx, that's the Adam's apple.
Okay, that's the Adam's apple.
You could see the thyroid gland over there. Over there, this thyroid gland, this one is a normal one. You get it? That's a normal thyroid gland. Okay. But when it gets inflamed, that's where you will see it will be enlarged.
And so is this the enlarged one or this is the perfect one? I think this is the perfect one.
This is a perfect one.
Okay.
This is a perfect one.
So let's
you see, this is
so the one down
the
is
one
a bit
up
enlarged.
is the perfect one, and the one down is enlarged.
But the color doesn't change.
No, it doesn't change. Yeah, it doesn't, because of the inflammation. It will be enlarged. So the top one is the normal one, and the down is the enlarged, which means it's inflamed.
So that's what protrudes out of the skin.
Of the skin
and comes.
Then you will see it under at the base of the neck.
So should it then, if it can't happen to the arm or the leg or any other part of it?
No,
it's
because the gland is located at the base of the neck.
The neck area. So what would you advise? I mean, for a lot of health reasons, it's been advised that we moderate our eating habits, even drinking and other things. But in this particular situation, what would you advise for prevention? The first aspect is you should get it tested. Everybody?
Sure, everybody.
Even before?
Yeah, because you see, overproduction of that hormones even affect the menstrual cycle of the females.
Oh. Okay.
Yeah, so you should get it tested based on how we are living now, our dietary aspect, and what we ingest in, the kind of chemicals we take in the system, and even the food we eat these days, many of them are chemically produced. So it is very, very advisable. You can walk into a facility and request for it.
A thyroid test.
You just go and then you ask for TFT or any private laboratory. You can go walk in there and ask for TFT. It will be tested for you because because it can have effect on even the menstrual cycle of the females. Then it can also have correlation with the fertility aspect.
Wow.
So for now, it is not about sit there and then let's see the signs and the symptoms. There are many signs and symptoms. We've not even for the time factor. So please, if the first thing that you should do is go to a facility and ask for it. Don't wait for the practitioner. Many practitioners will never even request for it, even if you are not well and you get there. They will not request for it.
It's sort of overlooked.
Yeah, because these hormones are the thermostat in the human system, and it has it links to all the cells in the human system. Many times you will be ill, or you go to the hospital several times, and they will tell you, "Oh, we don't know what is going on with you." They will conduct series of tests and come out because they've never gone to that parameter. They will tell you, "We don't know what is even wrong with you." They say, "Oh, the kidneys is fine, the liver is fine, or the the HB is fine, the ferritin is fine, but you still can't
It takes a
sleep.
while to identify that it could be from the
because
thyroid
this
gland.
condition can lead to pernicious anemia, can also even lead to hyperthyroidism. So you should walk in. The first advice is go and get it tested. Know the status of it. Then from there, your eating aspect, especially this white pain of food that we ingest in.
This what?
White pain. The white pain. We should limit it. Something we go to the pizzas, we go to the burgers, we go to this hot dogs, we go to these sausages. We should limit them.
So that's what you mean by a white pain.
White pain is highly refined. And then we go to this white bread, the white bread, sugar bread, and the tea bread. Yeah, we should do a little on them. We're not telling you to stay out out completely, because once a while you can use them, but we should do a little on them. Then we go in for the one with the fiber rich foods. Then we should also abstain from this aspartame drinks, these sugary drinks. For that one you can stay off. Because all those drinks that you see over there, they contains this chemical called aspartame, and the aspartame is very dangerous. It links to this condition. And then you can see us feeding our children with this sugary drinks. Now you see all water companies in the country, they are producing drinks. So you ask yourself, where are we getting those concentrate from? We don't produce apples in this country, you know. We have nothing like strawberries in this country, we know, but we have the concentrate to sell to the people. How many pieces of apples out there? The pieces of apple, 4 pieces of apples out there, how much will it cost? It will cost something 20 to 25 cedis. But here you have a drink that is given to you for 5 cedis, 6 cedis. Then we are causing so much harm. Sure, and we are telling you that it's a flavor. These flavors are coming with their sweetness. That is inculcated with the water, distilled water, selling for the people. So we should refrain from there.
In as much as the habits that causes the hyperthyroidism is the main cause to be scared of or to be worried about, the aspect of the fact that clinically it is not one of the first prompts that the practitioners would identify as having to be checked. So now you're saying that as practitioners, people should look out for it. And I don't know how conversant everybody else is with us you are, because if it is a brush off when people attend clinical checks, then how can we spread it out there for it to be one of the first checks when people complain of certain illnesses?
Yeah.
Do you understand what I'm trying to say?
I get it. But so with that, we can even have a program for it. So the education should be spread. We should spread the education. Yeah. The fact that we are practitioners sitting at the offices or at the consulting room does not mean that we are aware of everything. That is Some things we've studied them, but you have to prompt us. You get it? That is why you see patients go to certain places they are not being tested for. But they come to the other side, you do more investigation, then you can get it. So it is something we should sound an alarm. The authorities should help us. The public health education should come out.
But when you have your council meetings or your professional association meetings, I think some of these things should come up, because it's quite worrying to mention that people would go through several tests, but it could be the last to be looked at.
Yeah, and that is what is affecting the human system the most.
The various stages of this disease or this symptoms, what kind of treatments would be recommended?
Oh yeah, because what happens here is the stages. We have a stage where the treatments are not even, sometimes when it's set in the human system, you only have to correct the diet of the patient. Don't take this, don't take that. You know, we have people that goes to the table, the food is already prepared, but he or she will tell you that the salt in the food is not enough for me, so he or she will have to add
a pinch of it.
And that will the too much of iodine can also cause that.
Yes. But we were told that iodine deficiency rather causes.
Exactly. But what happens? What happens here is it's not all hyperthyroidism that is caused by iodine deficiency.
Okay.
So,
the goiter part.
so when you are being presented with your food, take it that way. Don't add extra table salt to your meals. And the way you keep doing that, it will affect you.
And then we know that when it comes to the protruding parts, which is the goiter part, so operation, you go to the extreme.
So over there, we can, the operation can be done to take even all or part of it can be taken out here. And then the other aspect, there's treatment available. There's treatment available. So if even with the protrusion or seeing the goiter over there, don't be afraid. Go. The surgery can be conducted for you, and you'll be fine.
Does it affect one's voice when it's done?
Sure. Because you can get sledge voice. It is true. That's it.
But you won't lose it completely.
You won't lose it completely. Yeah. And then what happens here is that when sometimes when these surgeries are conducted, you will be on medication for a little while, because especially if the gland is removed off, we have to keep you on medication for you to get the hormones working active little by little. You're active again. Sure.
So how about you've mentioned the parts that we play that causes it or brings it about. How about the natural things like water, polluted water, and pollution around us? Does that also have an effect?
Yeah, it also does, because contaminated waters can come with series of infections. Yeah, and then when the infections are also in the system, they go straight to the immunity, and then that also fights against the functions of the immunity. So it is also, we have to look properly with the water, the kind of water we take, the kind of food we take. And people will go out there, see a fruit that is having half side rotting, and then they'll say, oh, let me just cut part of it. And then, yeah, we have to be very careful. And then those that also eat from plastic products, that comes with the hot food. Hot food in plastic product, we should also refrain from.
Wow. It looks like this is an all-round.
Because what happened here is the bisphenol A or the BPA in the plastic material, when it comes into the system, it goes straight. It brings inflammation. Then that inflammation can go straight to the thyroid gland.
Thank you very much, Dr. Osman Ibrahim, from CEO of Nature Blend Clinic, for sharing this with us. You know, it's amazing how widespread hyperthyroidism can actually affect us, and we appreciate that. And I think the key word here is that just as you go for a prostate cancer test, or it's more of a prostate test and all the other tests that we would go for, you have to go for what's the short? TFT. So you go for your TFT and make sure your thyroid gland is
So when the TFT is done for you, you look for your T3 and the T4.
The technical things that doctors will talk about. Thanks for watching this part of the Breakfast Show. The Tuesday edition. Kwame Waja is around. The show continues. Stay with us.